Hello and welcome to our How to video series. In today's video, we'll be discussing the topic of testosterone injections and how to safely administer them. If you or someone you know has been advised to undergo testosterone replacement therapy, you're probably wondering how these injections work and how to administer them. Don't worry, we've got you covered. Now, we understand that medical procedures can be daunting, but fear not. Our step-by-step guide will make the process easy to follow and ensure that you have all the information you need to make informed decisions. Let's get started. Step 1. Gather materials: medication, needles, syringes, alcohol wipes, bandages, clean tissue or gauze, and a sharps container. Ensure that your workspace is clean and wash your hands. Step 2. Use an alcohol wipe to clean the top of your medication vial. Give it time to air dry. Step 3. Calculate the amount of medication needed for your injection. Consult with your healthcare professional or pharmacist for assistance. Step 4. Attach an 18-gauge needle to your syringe. Remove the safety cap from the needle. Step 5. Draw the appropriate amount of air into the syringe. The amount of air you need to draw into your syringe should be exactly the same as the amount of medication you're injecting. Step 6. Use the needle to pierce the rubber cap on the medication vial while it is upside down. Step 7. Inject the air into the vial. Ensure the needle tip is below the liquid surface. Step 8. Slowly draw on the medication. Ensure there are no bubbles, and if there are any, gently inject them back into the vial and then redraw the medication. Step 9. Remove the 18-gauge needle from the vial and dispose of it in your sharps container. Step 10. Select the appropriate injection needle size for your method of injection. For intramuscular, use a 22 or 23-gauge needle about 1 to 1.5 inches long. Use a 25 or 26-gauge needle about 5/8 of an inch long for subcutaneous. Step 11. Choose the injection site. For intramuscular, inject into the outer thigh or the upper outer buttock. For subcutaneous, inject into the belly or thigh. Step 12. Clean the injection site with a fresh alcohol wipe, then remove the safety cap from the needle. Step 13. Insert the needle. For intramuscular injections, insert the needle at a 90-degree angle. For subcutaneous injection, pinch the skin and fat of the abdomen between your fingers to the side of the belly button. Insert the needle gently at a 45-degree angle and advance into the fatty tissue under the skin. Step 14. Once mostly under the skin, inject the medication slowly using the syringe plunger. Step 15. Once you have used all of the medication, gently remove the needle and place it and the syringe into the sharps container. Step 16. Apply pressure and a Band-Aid. To manage any bleeding, place a clean piece of tissue or gauze onto the injection site, then apply light pressure. After a minute or two, apply a small bandage to the injection site if you desire. Remember, repeat the injection weekly, or as directed. Rotate between left and right buttocks and or quad muscles for intramuscular injections. Rotate between left and right sides of the abdomen for subcutaneous injections. Never reuse or share your needles to prevent any infections or cross-contamination. Once your sharp container is full, you can bring it to your local pharmacy. Remember, it is always important to consult with your healthcare provider before making any changes to your treatment plan. The information presented in this video is intended for educational purposes only and should not replace advice from your doctor or medical professional. We hope that you found this video informative and helpful. Thank you for watching, and be sure to subscribe for more resources and support. Remember, you've got this.